So if we disturb the homeostasis, we end up with disease. If we disturb nature, we end with calamities.
Food as medicine, and anything overdose is toxic to the body.
So everyone wants quick result. We don't have patience and we don't want to put effort.
Hype arrives faster than the science, and I think these weight loss medications are no different.
Tell me what to eat so that I lose weight.
Okay.
I will say don't eat.
So welcome to the program, doctor, and it's a pleasure to have you.
Thank you.
So for decades, obesity was just dismissed as lack of willpower. So before we begin and get into the science, let's settle this debate. Is obesity was lack of willpower? I mean, do obesity specialists really needed a job?
I think maybe it starts with lack of willpower, but over time it becomes a disease. And definitely obesity specialists have a job, and that is the in job for this century, because now it has become out of proportion. You see every part of the world getting affected. Earlier it was the well-to-do countries, but now it is the third world developing countries also which are facing the burden of obesity and the diseases associated with it.
But today, doctor, science tells us a different story about obesity. Obesity is more of a chronic disease, a metabolic disorder. It's got a lot to do with hormones and multi-system. So why do you think it is such a complex thing?
Basically, obesity is a central disease. We can say that there is a lot of hormonal play to develop this disease, and then the other diseases which are all linked to a metabolic upset. So when we say it has not started in one day for a single individual, it has evolved over time. It has evolved with our eating habits, with our lifestyle change from a very active hunter-gatherer type to a sedentary desk job, and the type of food ancient ancestors were taking, to generational change in the eating habits. But none of us actually think whether I need to eat this food or eat this much food or eat this type of food. But when we load it with the different types of food types, then the body starts reacting to it, and then body keeps telling us, but maybe this was not right. Now you see for children, there are extra large dresses available. That means what? The society is changing and the bodies are also changing, and everything adapts to that. But that's all external adaptation. Internal adaptation, if anything disturbs the main homeostatic mechanism, it causes disease. So if we disturb the homeostasis, we end up with disease. If we disturb nature, we end with calamities. So nature is always right. We have disturbed it and we are facing the consequences.
But tell me honestly, doctor, it might look simple, but why does losing weight seem so hard?
See, we are now trying to combat the nature again. Now, with all these eating habit and lifestyle changes, the internal system has created one bad scenario inside, which is difficult to handle from outside, because whatever hormonal changes are permanent. Initially, you may try with diet and exercise, but that needs persistence. That needs not persistence only that you go to one fancy gym and do for 1 hour or call a trainer home, but after that what you are doing. Are you being active? Are you seeing your food, what you are eating? It's not like that. So when the effort is not serious, then the result is also not serious.
So it's more complex and not just sometimes calories in and calories out, but your body's got a different story to say.
Yes, very much.
So doctor, what exactly, you are a bariatric surgeon now. So when does your role come into the picture when you have to treat obesity?
For us, surgery when your BMI is more than 30.
So do people normally understand that when you say your BMI is more than 30?
We try to explain in their terms. If you have to lose 30 kgs or more of your body weight, and which is reasonably difficult for a regular person to do it with diet and exercise, and then there are other diseases adding up to you.
So you were mentioning about the weight loss medications which are now in the market, and say people are just using it left, right and center. So do you think that has changed the way you practice bariatric surgery?
No, it has not changed the way, but it has at least brought out the society to accept that obesity needs treatment. My role is always there.
Yeah.
That when you fail all these things and you have so much weight, then you have to come to a surgeon.
Do you see that as a threat, weight loss injections? I mean, when people misuse it, or especially now without a prescription, what do you have to say?
See, initially when anything fad comes, then everyone jumps into try it. But medication is medication, and medication comes with its own set of rules. You have to follow the rules. You need someone to follow you up to see whether you're doing well with the medication, you're taking it properly or not. So sometimes there may be slight adverse reactions. So if you slyly take medication and then long run you end up with some problem, then there's no one to correct you at the right point, and you have to bear the consequences.
And do you see a set of patients who say, I don't want to undergo the surgery, I'm fine with the medications, with whatever weight, can I lose 30 to 40 kgs with these medications? Is that possible?
No. Research on the drugs have said they give you 10 to 15% of your excess body weight loss. So if someone needs to lose 50 kgs, so they'll lose 5 to 10 kgs. But understand, they have to take the medicine at a proper dose and lifetime. Whenever they leave the medication, the weight comes back immediately. You see, every day government keeps telling, don't fall for financial frauds. Why people are falling for financial when we have institutions like bank and all? Because quick money.
Yes.
So everyone wants quick result. We don't have patience and we don't want to put effort. So they think that one injection I'll melt. Then they get disheartened that I have spent so much. Medicines are costly. They are not cheap. Then they feel that I spent this much, and sometimes they don't have anyone to blame also, that they've taken it slyly. So they feel disheartened. So initial buzz will be there, then it will settle down.
So I think whenever a treatment becomes popular, the hype arrives faster than the science, and I think these weight loss medications are no different.
No different.
So talking about bariatric surgery, ma'am, what are the benefits you see, patients tell you that they have seen personally in their life after the surgery?
It's a second life.
Yes.
Someone who is become so huge, can't do their personal work, can't socialize, look conscious. They're not able to breathe properly. For a lady, not able to have her babies. If you give them a weight loss, and that gives them a new set of life which they can enjoy, for them it is a totally new life.
So let me ask you another question, ma'am. Why do you think people reach those numbers? I mean, don't you think it's easier to correct when they are just, say, about 10 kgs heavier or something?
Can be done, but then it needs a lot of effort and persistence. As I said, that daily when we do a lot of activities, we are not thinking of consequences. We are not thinking of tomorrow. That today, if I eat a 10-course meal at a wedding, I'm not thinking that do I need to eat so many calories and what is going to happen. And this will build up slowly. And after some time, you are helpless because you have missed the bus and then your body is not responding to whatever effort you want to put.
I think it's time we see food as medicine, and anything overdose is toxic to the body.
If the way this eating happen, we will have at least 50% of the population who will become young sick. We can't afford, because for us it is the population. If it is only fit and fine, then we are economically viable.
So on this note, let me ask you, how does your plate look like? I mean, are you very conscious with food habits and also exercise, especially being in this field?
First, at the start of the talk, as I told you, it was difficult to get a medium-sized dress.
Yes.
When my classmates were weighing 35-40 kgs, I weighed 50 kgs. So from that time, I know that weight is a trouble. And then coming into this medical field and then coming into surgical field, I have always seen how obesity, it not only for anything, for coming for a surgery, not able to get out of the bed and walking by yourself has made me understand that first is to control your eating habits. Food has been always trimmed in our house for so many years.
There's no unhealthy snacking in between.
No snacking in between. Only water is your snack. And no excess tea, coffee. No, we don't make multiple times tea, coffee and you're drinking whenever you're bored. No, all this. So a lot of people ask me, tell me what to eat so that I lose weight.
Okay.
I will say, don't eat, you will lose weight.
So how about when you attend these weddings or parties? I mean, you just skip the food
Nah,
part?
I just go and see all what is served, but I eat what I should eat.
Talking about bariatric surgery in this modern science world, ma'am, what are some latest advancements which we are seeing today and what are some future things that excite you?
For us now, operating on obese patients for a surgeon is the most difficult task. Now we have robotics. So robotics helps us to handle the obese patients easily, and the same surgeries are more comfortable to the surgeon now. And also the drugs have come. So if I have a very sick patient whom I need to prepare for the surgery, and if I feel 10-15 kgs of weight loss will make them a better anesthesia risk, then the drugs are there. So that I can use the drugs, allow them to lose 10-15 kgs so that their heart and lungs are less under pressure and work better. So from very high risk, I can get them to a regular risk.
So are there any myths that you would like to bust for everyone as far as obesity or bariatric surgery is concerned, ma'am?
See, a lot of people don't want to accept that it's all fat. They'll say it is water, air, something, gas, everything they'll tell. Then they feel that whenever I say bariatric surgery, they'll say complications. I said, you think how the weight is damaging you. So my surgery is not going to create any much harm. It is definitely going to reduce all the damage your weight is doing to you.
So before we wrap this episode, ma'am, if there are some people who are struggling to lose weight and who are not comfortable talking about obesity, so what would you like to tell them?
You accept obesity as a disease. Always go to a proper trained specialist and take advice. There's nothing to feel shy about it. It's always better that you get treated for it and get rid of your weight and the whole lot of diseases which are troubling you because of the weight. That will give you a fresh life and also extend your life rather than all the diseases together coming together and curtailing your life. Learn to enjoy food for its taste, not the volume. Pick your food and small quantities, 2-3 types on your plate, enjoy it and then feel happy about it. Always there is tomorrow. Tomorrow will come, more functions, more part. But we should be there for tomorrow. We should be fit and fine for tomorrow. We should be able to attend that function.
So thank you, doctor, for such an interesting conversation. Thank you so much.
Thank you.